Knock, knock.
Yeah.
Mr. Garcia, if they were, to give you a prescription, what, you wanna go to, there's on the CVS on Glendale Boulevard, Walgreens on West Sixth?
The Walgreens office.
On West Sixth, okay, I'll put that in.
No, that's okay. Good morning,
Okay.
social work. I'm just here to ask you a couple of questions and then I'm done. Is that doctor ready?
No.
So, I usually come in before the doctor just a couple of questions, so that will be your case plan, okay?
Okay.
How long have you been in shelter for? Homeless.
Is already out
We already housed you, where are you staying at?
downtown.
Downtown? Is that through single resident occupation? Like you have a SRO?
No.
No? Oh, okay. You just got,
I just really got there. I don't just like, I don't know there.
oh, no, you're fine. It's just always good to know, like, when the patient's out. Hey, how did you get the help through?
The people's concern.
Oh, the people concerned.
Yeah.
That's cool. Congratulations. Are you feeling happy?
Yeah. Yes.
Yeah, that's good. You just gotta take care of your days, cause make sure you like report stuff to the, my property manager, cause I used to work in one of those. And like the property managers don't take care of us.
It's a brand new building, so I just really moved in there.
Well,
It's a brand new building.
But anybody can use the property manager.
Yeah.
Anything like, somebody's not working there, hey, like, small, because.
Yeah, like the hotline was working all weekend last week, and it's a brand new building, so I was like, yeah, and they fixed it.
Good for you, that's such a big deal. So you're still gonna, still gonna get your GR, right?
Yeah.
Okay. And your health fresh?
Yeah.
Is the Canada section main housing?
Yeah, that's what it is.
Oh, okay. I'm happy for you, that's a big deal.
She felt 20 days ago, she was done x-rays,
Really nice. So you're gonna find a job soon, that's what you're trying to.
Yeah, they can help me out with all that.
Oh, good.
Yeah.
Oh, I'm so happy for you, you look so much healthier. Do you feel, I mean, I know you're sick, but what about the substance use, are you still using, or you're gonna try to, are you going to treatment?
I really, like, I've been so busy with all that stuff that I didn't like have to do it. Like with paperwork and everything I needed, so.
If you ever wanna just do, November, if you're ever interested, you can switch your LA care to Kaiser, it's open enrollment. And then, with Kaiser, there's just a permanent location medicine, like, even if you feel like you haven't used for a while, and like, you just wanna go to like a doctor or anything, you can go to the clinic, it's nice, and then they do like group, and then they can do IV on you. It's the days that you need that support, you know?
Yeah.
You can always use it.
Thank you.
Yeah, of course. Alright, seems like you're set up pretty good. Good to hear that. And then, there, and check, you have emergency contact number, right?
No, I don't know.
No, you don't wanna list anyone?
No, I don't have time to go over there.
You're fine. Okay, Steven. You're just waiting for the doctor, right?
Yeah.
Okay, let me close this.
Alright, thank you.
Congrats.
Thank you.
Hi, I'm here from social work.
Okay,
I'm just here to leave this research. Did the doctor come see you already?
not yet.
Okay, usually I come in before and just get some background and then they review my note, okay?
Okay.
How long have you been homeless for?
On and off since 22,
22. And then are you receiving GR and CalFresh?
$23 for CalFresh.
Oh, and then what about the GR?
No.
No? Okay. Did they tell you don't qualify?
Yeah, because I have SSDI.
Oh, you have SSDI. Okay. Are you a veteran?
No.
No? Okay. No, I just asked so I could see if I could bring you veteran resources. Have you ever gone to Wesley Clinic?
No.
There's a clinic by LACC. If you ever lose like your ID or anything, they could take you to the DMV and they pay for it and they transport you there.
Okay, yeah, I just got my driver's license last month, so I'm good.
Oh, okay. And then right now you're staying at a shelter.
No, that's why I've been coming. Well, it's primarily for my elbow, and then I have this wound where I'm still waiting for the dressing to be changed. But part of the whole like thing has been to find me like either emergency shelter, like a hotel or something like that.
When the doctor comes, you're gonna ask him like, "Can I go into Recoup Care?"
Recoup Care. Okay.
And say,
What's that?
I'm gonna tell you right now. Okay. So when you're telling me, you have to be confident.
Okay.
Say, do you think I qualify for Recoup Care for the wound care?
Okay.
Say because I'm scared it's gonna get infected and I'm gonna get sicker, you know? And say I've been monitoring it, but it's hard because I live out in the community. And kind of make it about your health.
Okay.
I could see if he has me do it, sometimes the case managers do it. He'll message me or she'll message me.
Okay.
And just say like, hey, I'm just worried. Have you got any like fevers because of them?
Yeah, like I have a slight fever and like chills a little bit.
Yeah, so when they come in, say like sometimes I feel like it's getting infected because I get like a fever, and then if he says no, like say like I think that would help.
Okay. And so, what is the Recoup Care? What does it
They
provide?
provide you like temporary housing.
Okay.
It's kind of like a facility, and then they monitor your wound and your elbow, and so you can be healthy again.
Okay.
Okay.
All right, great. Thank you.
No worries.
Oh, pretty. Okay. What's your first name?
Natalie.
Okay, thanks, Natalie.
Social work.
Hi, Dad. Hi, Miss Answers. How are you? What's going on?
I have emergency bus, so I talked to,
What's there?
yeah, and it's like, it's losing its connectivity.
She's gonna shout.
Yeah, if it's okay with you, I have to be here. Oh, on your back?
Yeah.
You have you get recurrent breathing syndrome?
Yeah.
Oh,
but
okay.
it's spreading, I guess, that's how.
Anything, okay. Wait, let me look at it. Yeah, sorry, I'm sorry. It's, okay, no, not it. No. It's like right, but, nothing in the genitals, right?
No,
Oh, okay. Yes, yeah. Okay. Are you taking?
and also back here.
It's like shingles. Yeah.
Yeah, and then-
That's on. Okay, so, are you taking the medication for it?
I haven't seen nothing, that's why I can't.
Okay, which pharmacy do you want to use? I have it. Oh, you have it already? Okay, I will get you some medication, okay, and then, I'll give you some information to put on the area, okay? That's it? That's it.
All right.
Okay, good luck, all right? Are you allergic to anything? Okay,
Get
get
dressed and we'll be ready then.
Do I see that medicine, what medicine I buy?
Yeah, that's what I'm giving you, yeah.
And I think it would go right now, because I just connected to
Well, it's not gonna do anything right now, you might as well just fill it and take it, I mean, I think it's gonna take a really long time to get from our pharmacy. And it's not really gonna change anything, but if you want a first dose, yeah, I can do it. Go ahead and get dressed though, okay?
Mr. Garcia, would you like anything to eat, sir?
Yeah,
Okay, I'm gonna give you some sandwiches and juice. How about you, Mr. Beverly? Are you on breakfast? All I have is make sandwiches and juice and
Yeah, that'd be
stuff.
great.
Let
Thank
me see
you.
if I can help. I'll bring some whatever I can have, okay?
Thanks.
I just have these, I'm so sorry. You're welcome, sir. is what I have in my packet.
Oh, thank you, thank you.
You're welcome.
Hello, Mr. Beverly. Hi, I'm Dr. Yu. Hi there.
Hello.
Hi, how you doing?
Doing all right.
What you looking at?
I was just working on some reports.
Can't stop working, huh? Okay, what's going on?
I just needed this dressing,
A new dressing change?
new
Okay.
dressing, and then
How long have you had this wound?
ow.
Ooh. How long has it been there?
Maybe 4 or 5 days.
Okay, are you taking medicine or antibiotics or anything for it?
They just gave me a prescription last night.
Okay, just started. Okay,
Yeah.
from where?
From across the street.
Okay.
But like I've been running the site fever and like chills.
Yeah. Did you did you get the medicine? Did you pick it up?
Yeah. I
Okay,
picked it up.
okay.
Yeah, I started it.
Okay.
And then like my elbow, between like this and my elbow.
Oh, that's a bulb there too. That's a bursitis, yeah. It's not hot though.
Yeah, not how.
How long has this been?
That's been for about a month.
Yeah, it's been a while. Yeah, this is a chronic issue. It's an effusion. It's basically, your elbow has it's a bursa. It's called a sac.
Okay.
And the best to describe it, let me make an example here. So, if I was to take this and so that it's not get rid of the fingers, but okay, imagine there's this, okay, and then I have this bone and this bone, right? So they connect, right? Two bones connect, so they connect between here.
Okay.
So imagine you held that, and then I took that top bone and lower bone, and now they're doing this, right? So it deflated, but you can imagine if it's inflated, right? There's like a little sac,
Sure.
right? So that sac that's right there, that's called the bursa.
Okay.
And what it does is that sac in the space actually has lubricant. It has like synovial fluid, we call it. And so that's why it can do this. So your elbow bends and it moves and it doesn't hurt, right?
Right.
So, but what happens sometimes is, and this can happen from trauma or stress, repetitive use, or if you banged it once, or you do some kind of exercise or work or whatever, if you keep doing this to the joint, right, then sometimes this thing gets inflamed, and then the swelling, the fluid, instead of it just being like a nice thin layer like that,
Right.
it swells up. And that
Gotcha.
same fluid, it's the same fluid that's in there, but it gets bigger.
Gotcha.
And then it actually can inflate like that, right? And then so now when I'm pressing it, that's why it bulges out like that.
Right.
You see what I'm saying, that little bulge?
Yeah.
So that's a olecranon bursitis, that's what we call it. But the difference is these things can go down on their own if you just kind of are more careful with it and you don't hit it. But they can also get worse. They can get infected.
Mhm.
If it was infected, this would be really painful, like a pimple. You know how our pimples really hurt?
Sure.
And it would be hot and red and swollen. And I'm not seeing that. Yeah, now that's the similar kind of thing.
Yeah.
But this is different because this is on the outside. That's a wound infection. So how'd that happen? Did you fall or scratch it or
I have
scrape
no
it? Did you get
idea.
a bite?
Well, it's my,
Spider bites
my
or-
homeless status. It really
Oh.
it has me like
Okay,
prone to these kinds of things.
gotcha. Yeah. So that's how many days you had that?
I think like 4 or 5 days.
Yeah. So the antibiotics should help to clean it, kill the bacteria. Your body is doing what it should when you have an infection in the skin. What it does is it forms a crater, it forms a wall, and then it opens up, right? Like it erupts, right?
Okay.
So the dead skin on the top, that's why the skin came off.
Right.
And then everything is trying to like do this, it's trying to push it all out and do
Exactly.
that, right?
Yeah.
And it's already open. If it wasn't open, then we would have to cut it open. But it's already open. So it's
Okay.
doing what it naturally does. It should heal out, everything should push out. If you do the antibiotics and you keep that under control, then that'll kill it and it'll clean it, and then your body should continue to do the healing.
Okay.
Don't mess with it, don't touch it too much. I'm gonna have the nurse just clean it up, we'll put a new dressing on that for you. And then I want you to keep it clean, so that means keeping it covered all the time. And then you can do a little bit of antiseptic cleaning stuff. I'll have her give you something to kind of do a little just hygiene kind of
Okay.
thing with. I have these little wipes. It'll sting for a few seconds, but it's worth it.
Okay.
And you don't have to go directly in them, just clean around it. Right,
Okay.
and right at the edge, maybe a little bit on the edge and inside. Because
Okay.
the antibiotics are doing the big job, but I want everything around it to be clean because I don't want you to get it recontaminated with other
Exactly.
stuff,
And
right?
which goes
That's the whole point of why cleaning is good, yeah.
Yeah, which goes along with the whole homeless thing. The social worker, she came in, she
Yeah.
suggested me to request to you to have recoup care because of the I guess vulnerabilities from being homeless to
Yeah.
be able to keep it clean and sterile and
Yeah.
just the environmental thing being an issue. In order to keep this clean and keep it from getting infected, that would be
Uh-huh.
helpful.
Yeah, so there are, well, you can always come back here, we can do the changes for you if we need to as they're getting better. I would go to see the doctors that saw them, so they know they're getting response with the original antibiotics, and if not, they can switch those up as well too. So
Yeah, they were right across. They were right across the street. The urgent care.
The Kaiser?
Kaiser, yeah.
Oh, yeah, okay, yeah. Yeah, so that's reasonable. You can go in there too. You're a Kaiser member?
Yeah,
Yeah, go into there. You don't have to wait here. I mean, whoever's not busy. I don't know what your copay is. You have to go for
Well, I don't have one. I pay the premium every month.
Okay,
So.
good. Yeah, then you can come back here. We can change it for you if we need to. But yeah, urgent care is easy. They'll just keep rechecking in and they can do dressing changes for you too. Because if you don't have a home, if you got a home, then we can say, we can even get home visits to the home. But if you don't have a place, then I can't send anybody to you.
Right, and
So
that
you
was
just-
the other thing. Like that. Well, that was kind of like the whole point of me coming here too, was just to have, even from the social worker standpoint, so that I could have housing, like either this for the simple fact of this being the primary thing at this point that
Yeah.
needs attention. Still like housing, either like at a shelter if there was some.
Yeah, there's some resources. We can give you
Hotel.
places you can go for shelter stuff. So I'll ask the social
Okay.
worker to see you. But we wouldn't hospitalize you just for that.
Sure,
to be in
sure,
a
sure.
hospital.
Yeah, no.
Yeah. And you don't need to do that. You don't want to be because now you're around germs.
Yeah.
And actually, you can get super infections on top of that as well if you're in a hospital environment. The different infections that you gain from the hospital versus on the street,
Right.
the ones in the hospital are worse.
Really? Okay.
Yeah, because they're the ones that were sicker, the ones that have been treated. They can be resistant ones.
Wow.
So yeah, if you don't need to be in a hospital, don't be, because then
Okay.
you'll get sick from being in a hospital. You know what I mean?
I just need to have stability as
Yeah.
far as a roof.
So we'll ask the social worker to help you with that.
Okay, thank you.
Natalie, the social worker saw you. Did she
Yes,
did you ask her
Natalie.
that information?
Yeah, she recommended for me to bring up the recoup care to the doctor. So
What care?
it's called recoup care. She said.
I'll talk to her about that. I don't
Okay.
know exactly
Okay,
what that
but
is.
this any like shelter or hotel voucher or something like that they told me to mention would be
Well, no, that
helpful.
doesn't come from the medical staff. That usually comes
The
from
social
them.
worker?
Yeah. We'll talk to them.
Okay.
We'll ask them.
All right,
Okay?
great, thank
Yeah.
you.
Thank you. Yeah.